All right, it's 1 minute past 12 and we are ready to start our webinar. We will talk about language barriers and also about how to reduce them within anesthesiology, post-op and the ICU. My name is Maja Magnusson. I'm the CEO and co-founder of Care to Translate, and I have two speakers with me today. I have Annie Backman, who is also a co-founder at Care to Translate, a medical doctor, and our CMedO. And I have our guest speaker, Irene Lie, from the University Hospital in Oslo. She is a professor, a researcher, and a special care nurse. And our agenda today will be a brief introduction about Care to Translate, and a very quick demo about how our product works. And then I will hand over to Annie, who will tell you about how our app can be used in these three areas within the healthcare sector. And after, Irene will talk about the case study at Oslo University Hospital and a research study that has been based upon Care to Translate at the thorax department. Afterwards, you will be welcome to ask questions and talk to our speakers. And during the entire presentation, you will be able to also write down the questions in our chat. All right, so a brief introduction. What is Care to Translate? A medical translator that can be used by healthcare professionals and patients. It is verified by native speakers with medical expertise. And you can use it on smart devices such as your phone, a tablet, and also with your computer. It is available in 45 languages today. All translations are played in text and sound, and it can be used online and offline 24/7. And you can use Care to Translate throughout the entire patient journey. You can use it to register the patient and ask, for example, to show the patient to show their ID card. You can ask important safety questions to ensure patient safety. You can talk and also calm the patient during examination and instruct the patient. You can inform the patient during their entire stay and also give information before discharge. And as I said, the product can be customized to different areas. You can use ready-made templates for different areas, such as post-op, for example. You can also edit these templates and add new ones based on your specific needs or maybe different roles within your team. You can share these lists with your entire department and therefore also ensure consistent communication, no matter the language. And now it's time for a quick demo, and I want you to see how you could use Care to Translate, for example, in your department. Here you see our app. I'm showing you an account made for the post-operative care department. The blue icons are different playlists, and in each playlist, you can structure different phrases to inform or give instructions to the patient, or just to tell them, I'm using this app to talk to you. To play a translation, you simply click on the phrase.
Просто дайте відповідь так чи ні.
And the translation is played in text and sound. To change the patient language, you simply click on the language picker, and you can scroll or search for the language you would like to use. Some languages have different dialects, and you can choose the one that is applicable for a patient, and also what gender to make the translation even more suitable for the patient. And now you're back in the same list and can translate the same phrase, but in Spanish.
Conteste solo Sí o no.
As I said, you can structure the playlist to make it more suitable for a specific department. And for the postoperative care, it might be important to talk about circulation, to inform the patient, but also ask important questions like, does your chest feel tight? Or have you felt palpitations? And also to ensure the patient that this is really normal. You might talk to the patient about breathing and also give breathing instruction or inform the patient about the machines that is surrounding the patient. And what we have seen as a really important area for communication is pain relief, where you can ask about the intensity of the pain, but also to understand where is the pain located and how does it feel. And this was the brief demo I wanted to show you. And if you have more questions, you're welcome to ask us afterwards. And for everyone joining us today, we have a special offer. If you're eager or interested to trial our app, you can do so for free for 2 entire months. And then if you would like to proceed to actually use our product as a customer and buy a license, we have the special offer today that you can buy 3 licenses at the price of 1. So you can cover 3 departments at the price of 1 department. So if you're interested to learning more about this, please feel free to contact us afterwards. All right. And now it's time to hear from our first speaker, Annie Backman. Welcome, Annie.
Thank you. Thank you so much. I'm Annie Backman. I also work at Care to Translate, just like Maya said. I used to work as a doctor previously, a long time ago. And for the past 6 years, I've been involved in the development of our phrase content in this tool that we have developed. And within the fields of anesthesiology and perioperative care and intensive care, there is definitely a lot to gain if you have a calm and informed and therefore also compliant patient. And there is a lot of communication in the different stages within this area. And a lot is fairly similar from patient to patient, which makes this tool pretty useful because it's not feasible to have an interpreter at place throughout the whole patient journey. It's not practically possible and not affordable, and also interpreter availability tends to have a limit, to say the least. So it's simply impossible to have an interpreter at place all the time. But the patient needs communication throughout the whole journey, right? And the patient might get a couple, or if they're lucky, a handful of interpreter sessions. But all that time in between, you can use Care to Translate to communicate. And here we have some examples of dialogues that can be covered with our tool. So for example, you can ask your preoperative questions in your checklist. If you're the anesthesiologist, you can inform the patient before the surgery just what is going to happen. And you can also use it when administering the general anesthesia, like on the operation theater just before sedating the patient. For example, instructing how to breathe and etc. In the postoperative unit, you can inform and ask about a variety of symptoms of the patient, and you can give information about restrictions and things like that. In the ICU, you can monitor the status of the patient using daily questions with help of the Care to Translate tool. And you can also explain regarding apparatus and machines and procedures surrounding the patient, which can be quite confusing if you're already in a state that makes you be at the ICU. Also down below, you can see in yellow, calming and informing relatives is also pretty important for these patients. And there I just want to alert you, if you use machine translations, commercial tools, this is an example of a word that is pretty hard to translate between languages. Some of you here are based in Sweden, and in Swedish we have a word called anhörig, which covers both relatives and other close contacts. And if you try to translate that with a machine translation, you can get a variety of different results, from relative to cousin to darling or other more romantically connotated words. And if you don't know what comes out in the other language on the other side, it can become pretty strange when you communicate to the patient or to the relative. So just a little warning tip. Machine translation is not safe to use in this setting. So I'm going to give you a few scenarios where you can use Care to Translate. This first example is when the patient wakes up. It could be a planned waking up or unplanned or just after surgery. And in this example, I think, yes, I put in the intensive care unit. You can just communicate in the patient's language. Inform a little bit. Tell the patient how long they've been asleep for. Tell them that your relatives know that you're here, and also inform them that you will be able to communicate via an interpreter, just not right now, but there will be a time when you can ask a lot of questions and we can have a deeper conversation. And actually, pain is one of the most, or it is the most common topic to communicate around with our tool, just like Maya mentioned before. It is highly relevant in this setting. You can both ask just about presence of pain, but also you can assess the level and ask the patient to rate the scale from 0 to 10, and the patient can easily answer without any verbal language, only body language, which is very handy if you need to do this several times to assess the time scale of the pain. You can also differentiate between different types of pain, like for example, if it's a stabbing sensation, like from a sharp knife, the patient answers, yes, this is what I feel, by nodding. You can ask if it hurts all the time without a pause. No, this is not the case for our imaginative patient. So it's not a continuous pain. You can ask if you're pain-free between attacks. So this gives you a lot of information that you would not have been able to get just by gestures or Google Translate or similar. You can also inform the patient that you will give some treatment to alleviate the pain. For example, some morphine intravenously. The patient usually has other needs, and you can ask questions about symptoms. If the patient feels nauseous or even needs to vomit, you can instruct the patient to lie still. Since a lot of patients in this setting can be a little bit confused, maybe just woken up. And that's a natural thing for humans to start fidgeting and moving and pulling the tubes and things. So you can just calm the patient down and instruct them. You can ask if they need to pee. Usually a patient maybe has a catheter, and you can explain how that works. Also ask if the patient wants to moisten their mouth with water, for example. These little things that you would say to all your patients, but you need to come around somehow when you don't have the same language. Another area where you can use the Care to Translate as a tool is assessing the patient's status, for example, neurological status. You can do your daily wake-ups and instruct the patient to raise their arms or move their legs or wiggle their toes to assess just how they are progressing. And not to forget there, the third question, may I examine you? Just being a little polite and creating this bond with the patient that gives a lot better mutual understanding of what is going on and yeah, creating a relation to the patient. You can also do a little deeper examination of sense of touch. And not only ask if you can feel that I'm touching you to the patients, but also ask, does it feel the same on the both sides? To make sure that the neurologic status is as you suspect. And ask if it feels cold. This one can also be used when administering local anesthesia, of course, to check if the anesthesia is good. Yes, and not to forget also these little things that we who speak the same language say to each other all the time, like thank you or take care or I am here, I will take care of you, things that really calms the patient down. From our experience, the patients are super happy and sometimes impressed or surprised that they get these things in their own language and can understand that the patient are here for them. Yes, that was my final example and some of my thoughts. And I will give the word back to Maja first.
Yes, thank you, Annie. Great examples, and these come from users and customers that have implemented Care to Translate. And so is the next speaker, our guest speaker, Irene Lie. She has been using the app within her department and also doing a research study how the app can actually help facilitate communication throughout the entire patient journey. Welcome, Irene. We are so happy that you made the time to join us in our webinar today. And maybe first, could you please tell us a bit about your background and your role at the Oslo University Hospital?
Yeah, thank you. You hear me?
Yes, very well.
Yes. So hello, everyone, and thank you for the invitation. So I'm a critical care nurse. I have actually working for decades with heart surgery patient at intensive care units at Department of Cardiothoracic Surgery here at Oslo University Hospital. I'm also a senior researcher and professor at NTNU. So that's kind of my background.
Thank you. And how do language barriers impact patient care and safety throughout the patient pathway within your special area of expertise?
Yeah, so language barriers, we are well known. We know it from clinical practice and also into research. And we know that it is often resulting in miscommunication between the healthcare professional and the patients. And this could lead to decreased patient satisfaction and also compromise the patient's safety. For example, it could be an increase in adverse events.
All right. And maybe a follow-up question on that. is it easy for you to get a hold of interpreters when you need it? How does that scenario look like for you?
Yeah, so first of all, I have to mention, due to the rules of the hospital, that we if we have longer plans conversation with the patient, we have to order for interpreter. Yeah, but it's a challenge. We realized during the study, I will tell you a little about the challenge of getting like from Ukraine, Russia, and so on. So then this tool couldn't be the one for communication, but it's add in, especially in clinical practice where we are out there with the patient 24/7 in hospital.
Yeah, thank you. And maybe to give our audience a bit of background, what motivated Oslo University Hospital to integrate Care to Translate into its healthcare practices?
Yeah, so it's kind of take a little step back to the idea of a translation tool for communication with minority-speaking patients. And it was driven by the fact that we continue to ask the patients, informal caregivers, when they were visiting, to translate short phrases on a post-it note for healthcare professionals' communication with the patient. And we also used Google Translate. And that could actually end out in funny translation, and that was not respectful for the patient. So we really needed a secured medical translation tool for use in clinical practice. And back in 2022, the years is running fast, then Southeastern Norway Regional Health Authority and Oslo University Hospital in cooperation choose Care to Translate. And at present time, 100 departments at Oslo University Hospital is actually using the tool. And it's like you had example, Annie, from pre-hospital, psychiatry, emergency, pediatrics. And I also want to mention for the cardiothoracic department where I'm working that we now are preparing for adjusting the tool for our caregivers to the heart surgery children. So all in all, it's kind of great.
And so I mentioned before you were part of the pilot research study. What were the objectives and design of this research study conducted involving Care to Translate?
Yeah, so I was the project leader of what we call the research study, a pilot, and actually we have over 100 interviews, so it's kind of a big pilot. But anyway, we were using the dynamic UX design to ongoing adapt the translation tool for use during the heart surgery patient clinical pathway at hospital. So we had two objectives. First of all, to customize Care to Translate, the tool, to our patients and healthcare professionals. And then we were testing the user experiences. And the users defined as the healthcare professionals and the patients. And we did this customizing in close cooperation with our clinical colleagues out there in the department, working at the ward, at the ICU, at step down, the operation room, and so on. So we customized the playlist with relevant phrases, and we also added some money to buy some phrases. So we really got it with the phrases that we could use and be happy with our colleagues in the clinical use. And when we were kind of designing this, we used a frame, the ABCDE assessment. If you're a clinician, you know what I'm talking about, air to breathe, the circulation, and so on, when we were choosing the phrases. And for the first time, we were actually using safe surgery checklist in the language of the patient. It took like 2024 before we could have that. So, and for testing the Care to Translate, we used both questionnaires and interview to get the user's feedback. And the results are in kind of the loop to be published, take some time. And I also want to tell you that international heart congresses we have presented last year, and is a great interest into the results. So yeah, kind of that.
Yeah, we are also really excited for you to be doing and concluding this research study. Is there any key finding or insight from the study that stood out to you that you are able to share with us?
Yeah, so what our colleagues, the healthcare professionals, they experienced that the tool was a way to build trust with the patient. It was useful to inform and to secure mapping of patient symptoms, especially pain, as Annie was talking about.
Yeah. And is there any specific story or positive outcome resulting from the use of the app at your hospital? Is there anything you know?
Yeah, I could say like one critical care nurse, one of my colleagues, kind of summed it up by saying, without the tool, I would not have been able to communicate with the patient at all. And if I should choose one clinical case example, could be a heart surgery patient with arrhythmia, like a heartbeat in high speed shortly after surgery. And in that situation with an awakened patient, the nurse used the tool to both inform and symptom assess the patient. She said, like, I have informed you, doctor, I will give you some medication to lower your heart rate. It is not unusual. And the patient expressed to understand the information and that he felt safe in the situation. And that is kind of the best feedback.
Yeah.
So.
Yeah, thank you so much for sharing this with us. Is there anything, if you would give any advice to healthcare professionals or organizations thinking about implementing these kind of tool, is there any examples of best practice for integrate an app like Care to Translate into daily workflows within the critical care setting?
Yeah, so in this project, we got funding to have a research nurse. So what out of our experience, we will underline it's crucial for succeeding in implementation that each unit or department has a contact person for follow-up in implementation of the tool. It's not done by itself, but if you do it kind of customize it, have follow-up of a contact person, then you will probably have happy patients. Couldn't be better. Thank you.
Yes. Thank you. And is there anything else that I haven't asked you about that you would like to comment on or add?
Well, I could kind of add that the cooperation with Care to Translate, and you have not paid me for saying this, just to say it, but the cooperation in customizing, in be service-minded, that was also crucial to have the succeed we experienced with this exact project. So that's why I'm happy to here to share. And maybe I don't have anything else. Maybe it pop up some question. I'm happy to contribute. Thank you.
Yes. So thank you so much, Irene, for providing us with your time today and telling a bit more about your experience. And also, of course, again, thank you, Annie. Now, I want to open up the floor to questions from the audience. And it is possible for you to write the question in the chat, but we will also make it possible, I think, that you can communicate verbally and to put on your microphone if you want to ask the question verbally. And I have a first question here already for Irene. It's the question about do you currently or still use other apps next to Care to Translate for communication?
And for that, I have a solid response, and it is like no.
Good.
It's no question to go back to Google Translate and kind of embarrassing the patient with the wrong. So it's only Care to Translate. And just to add a comment on that is like my colleagues also said, using Care to Translate with medical translated phrases make also the you are secured when you are, for example, do the symptom assessment of the patient. Yeah.
Right. Thank you. Here was another question, and maybe it's more the question for care to translate, and maybe Annie or I can also answer. Is it possible to transverse the dialogue in the app if we need an answer from the patient besides yes, no, and pointing?
Well, the patient can use the app as well. You can swap the library, so to speak, so that you are in patient mode, so that the patient can express some phrases or have some other questions if the patient has questions for the healthcare staff. It is possible, yes. Do you want to add something, Maja?
Yeah, I can add that it's also possible to add like examples of answers. For example, if you want to talk about the color of the discharge or something, you could add different kind of colors as options. So there can be more answer alternatives for the patient besides yes and no. But it's also worth mentioning that it's good to have it planned through. But if you have planned it through, and Irene and her team did a lot of planning, then you have really optimized your dialogues list and can receive also more detailed answers from the patient.
In the example that you give, you need to show the device for the patient so that they can see brown, red, yellow, and tap on it with their finger.
Yeah, exactly. And there's another question: what has the reaction been from other parts of the hospital? Irene, I don't know if you had contact with other parts of the hospitals and other departments. Do you know anything?
My life is around the heart patient, so
Yeah.
So
Yeah.
I don't have details, but as you had some example, Annie, it's from the Rus Motak emergency and so on. So it's used out there, and if anyone want to have more example from Oslo University Hospital, I can be kind of a contact person. You can I can get you in contact with the right department if somebody like that. I'm happy to help out with that.
Yeah, it's very kind. And as you mentioned, there are about 100 departments using the app at Oslo University Department, and it started in April last year when the University Hospital opened up and onboarded different kinds of departments besides the pilots. And so the amount of departments has been growing really fast in less than 12 months. So from our perspective, it seems to be appreciated, and also the responses we have received so far. Here is another question from Elisa. In what way did you need to consider GDPR during this implementation? To patient and personal data. I don't know if you were too much involved, Irene. I think you talked about the different stakeholders that were involved in the procurement process. And there, of course, you had support from the IT department and the patient safety department. Yeah, and I think the only thing I could add here is that we don't store patient data in our app at all. So it's only based on the different kind of phrases you can play, and you will select the language of the patient. You will select if the patient is referred to as a female or male. But other than that, no information about who this person is will be added to the product and stored in any way.
And I think, Maya, that's the crucial thing. That it's not, nothing is stored. In this study I refer to, the research study, of course, we have informed consent from both patient and healthcare professionals, and approved from the data protection officer. So, but that is on the side since it's a study. But since nothing is stored, then it's okay. So, and as you mentioned, the stakeholders, that was crucial to have this buying up, like care to translate and sort it out in the department. So you have to have the right person all over to get succeeded.
And thank you, Irene. And I also there was a hand raised by one of our guests,
I think it was Kjetil. Yes.
Yes, I just wanted to confirm that the GDPR considerations are being held very high when we implement it in Ålesund Hospital. And the Care to Translate application is the only application that will be approved at the current moment, and that complies with the GDPR rules in Norway.
Yeah, thank you. Okay, let's see. There is another question for Irene. How did it go introducing the tool? What was hard and what went better than expected?
I can start with, it's like with every new thing you implement in a department, it's you need follow-up and you need to sell it in on behalf of the patients. So that's why to have dedicated persons, daily follow-up. We were there all day, morning to evening, and customize the tool, as I said. So when you get on shift, when you have a patient to take off the respiratory therapy and so on, they found the phrases that they could use. So, and then when we came out longer in the study, then it's kind of running, because then the phrases was spot on and so on. And then that was kind of more happy moments. When we, yeah, so maybe that was the answer. So
yeah, thank you. And maybe also following up, I'm not sure if it has frozen a bit now, maybe for Irene. But then, yeah, maybe I'm gonna ask Annie then. If you would highlight, you did already highlight a few areas, but if you think about the feedback we have received within these areas, what is the main used category of phrases or area that is requested?
Yeah, from what I've heard from current customers, I would say that the postoperative situation is most common, or where they have the most use for the app, because it's such a crucial time to calm the patient and ask for a lot of different symptoms. Yeah, that's what I would say.
All right, and it seems like we have maybe lost Irene now, but we got a lot of great answers on the questions. And as Irene said, she is happy to be a point of contact into also the University Hospital in Oslo if you would have more questions. So maybe we respect the time and start wrapping up. And just a reminder to you, everyone who has joined today, you will be able to make use of our offer that we have set up for any new departments who would like to trial the product. So you will get 2 months for free and then 3 departments for the price of 1. So if you're interested to learn more about this, feel free to contact me and my team. And I hope you enjoyed this lunch webinar today, and hopefully we see you again. So thank you so much. You can download the app for free and try it. And if you want to have a more extended view of the product, you can also feel free to contact us, and we can provide you with a test version where you can see all the different kinds of departments and areas that we cover. So thank you, Irene, who is not here at the moment, but thank you so much, Irene Lie. And thank you also, Annie, for your great examples. And have a nice afternoon, everyone. Goodbye.